Alright, so my name is Claire. I will be conducting a 10 to 15 minute assessment on you. What I'm trying to look for is movement, we're trying to look for behavior, and we're trying to look for your cognition throughout this video, okay? Do you have any questions?
No.
Okay, so I washed my hands. What we're going to start off with is your vital signs. So the CNA checked your vital signs. So our blood pressure is 105/72, heart rate of 68, respiration 16, temperature of 98, and you have no pain. Is that correct?
That's correct.
Okay, so can you go ahead and tell me your first and last name
Jamie Emma,
and your date of birth?
12/09/1986.
Okay, what's today?
Today is July 11th, 2013, I'm sorry.
Do you know what time it is of the day?
It's almost 11 o'clock. It's about quarter to 11.
Alright, so right here I'm just checking if you're alert and oriented and you know what is your surroundings, okay? So I'm going to check your head. I'm going to look for normocephalus. We're trying to check for any abnormalities and some tenderness, okay? We're also going to look at your scalp. We're going to look for any symmetry. We're going to look for any dryness or dandruff. Your head looks great. We want to palpate for any tenderness. Does it hurt anywhere?
No.
No? Okay. I want to go ahead and palpate your muscles, your muscles right here, your trapezius. Any tenderness?
No.
And I see that they're all symmetrical. I want to go ahead and check for your smile. Can you smile for me? Okay, they're symmetric. Can you frown? Can you raise your eyebrows? Good. All right, so they're all symmetrical. Can you stick out your tongue and puff your cheeks? So what I'm trying to do is check your facial nerves, okay? Now what we're going to do is check your nostrils. I want to make sure they're symmetrical. Any tenderness, anything? Okay, I'm going to have you hold one nostril. Okay, inhale. Okay, blow out. Okay, go ahead and do the other side. Okay, so I hear clearness. I don't see any tenderness, and I don't see any problems with breathing. Is that correct?
That's correct.
Okay, so what we're going to do next is look at the ears. I'm going to palpate for any tenderness in your ears, any nose. Feels great. I'm going to have you go ahead. I'm going to check the other ear first. I'm going to have you hold one of the ears shut. I'm going to whisper 3 things to you, and I want you to repeat it out loud, okay?
1, 2, 3.
All right, good. And I'm going to have you cover the other ear.
4, 5, 6.
Very good. So what I'm trying to do is do the whisper test. I want to see if there's any occlusions or anything going on with your ears where you can't hear correctly, okay? I'm going to have you, that was testing your cranial nerve 8. Now we're going to have you check your eyes. What we're going to have you do is check for visual acuity, your left and your right eye. And I don't have a Snellen chart, but imagine this is a Snellen chart. What I'm trying to do is hold it 14 inches away. For 20/20 vision, you should be able to read the bottom letters clearly. Do you wear any eye contacts or any glasses?
No.
Okay, good. So that's how this test would be.
Okay.
Now, what I'm doing is having you hold this against your eye. So I want you to move this way, up and down. Okay, so I'm checking for your muscular function in the eyes, okay? So go ahead and cover your other eye. We'll have you look this way, up and down, straight ahead. Very good. All right, so put that back down. What I want to do next is I'm going to check for your pupil. Look straight ahead. What I'm checking here is for any equal reactions to light, if they're constricting correctly. So that's what I'm also checking on, okay? That's checking cranial nerve 2, especially with moving your eyes around. What we're going to check now is for cranial nerve 3, 4, and 6. I want you to follow my finger side to side, up and down. All right, very good. Okay, I want you to open your mouth. Look for any redness, any blisters. Very good. Any problems with it?
No.
I want you to say ah.
This
This is checking cranial nerve number 9 and 10. Go ahead and take your tongue out, stick it out. Very good. So that's checking cranial nerve 12. Okay? Move your tongue side to side. Very good. Okay. So now we want to look at your muscle jaw and see if you have any TMJ or anything like that. We're also checking for your trigeminal nerve. Okay? Open your mouth. Okay? Close. Open. Move side to side. All right. Sounds good to me. All right. We're going to look for some sensory nerves. So I want you to close your eyes. Tell me if you start feeling it, okay?
Yes. 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 Yes.
Okay. Okay, so that means it's intact. It's all working. All your nerves are working fine. Okay, we're going to check for lymph nodes. I'm going to go around your neck and I'm going to check. So it's symmetrical. Any pain?
No.
No? Okay, feel good. Alright, good. So, now what I want to do is check your clavicles. This is around the area right here for the occipital muscles. Very good. Then I'm going to look at your chest. It's a 2-to-1 ratio when you breathe. Okay, I'm going to come around with you. I want you to take deep breaths. Okay, very good. Symmetric. I'm going to go ahead and listen to your lungs, okay? Deep breath. This is the side. Okay, I'm going to listen to the front side too. Alright, very good. Next, I'm going to have you lie down.